Hi, my name is Jennifer Salazar, and my presentation is on cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is an autosomal recessive disorder that affects the exocrine glands. The individual with cystic fibrosis inherits two mutated alleles on the cystic fibrosis transmembrane regulator gene, or the CFTR gene for short. This mutation results in the diminished ability to transport chloride ions across the cell membrane and leads to a buildup of chloride and water in the organs. This buildup results in the thickened secretions that block ducts and form cysts. In order for an individual to inherit this disorder, they must inherit two mutated alleles, one from each parent. What is the clinical significance of cystic fibrosis? Cystic fibrosis is the most common fatal autosomal recessive disorder in Caucasians. While it is found among individuals of all races, it is most common in whites of Northern and Western European heritage. 1 out of every 3,000 live Caucasian births in the United States will have cystic fibrosis. In the U.S., 1,000 new cases of cystic fibrosis are diagnosed each year, and 75% of those individuals will be diagnosed by their second birthday. It is also estimated that at least 1 out of every 20 to 30 Caucasian Americans are carriers for cystic fibrosis. Currently in the U.S. alone, about 30,000 children and adults have been diagnosed, with almost half of these individuals being over the age of 18. This once fatal childhood disease now has a median life expectancy into the late 30s. How is cystic fibrosis detrimental to the health of the human? The lungs and the pancreas are the organs that are most affected by cystic fibrosis. The liver, salivary glands, and the testes are also affected, but to a much lesser extent. The lungs present with the most dangerous complications. The persistent thick, sticky mucus narrows the airways and causes bacteria to become trapped in the lungs. This often leads to frequent lower respiratory infections. These infections result in inflammation, chronic bronchitis, bronchiectasis, increased alveolar compliance, and eventually to respiratory failure. This thick, sticky mucus also plugs the pancreatic ducts. The plugging of the ducts initially leads to a reduction in the production of pancreatic enzymes used to digest fats and proteins. This leads to malnutrition, smaller stature, and steatorrhea. During late stages of cystic fibrosis, the individual may develop diabetes as well. The liver and the gallbladder are also affected by the mucus deposits. Eventually, these deposits lead to liver failure. Cystic fibrosis can cause changes to the salivary gland ducts. This causes them to dilate and produce abnormal saliva. Male infertility is also a common complication of cystic fibrosis. This is caused by the failure of the vas deferens to develop properly. The male is able to create sperm, but has no way to transport the sperm from the epididymis to the urethra, resulting in infertility. Medical advances to alleviate the suffering caused by cystic fibrosis. There is currently no cure for cystic fibrosis, and treatment is mainly focused on managing symptoms. The best way for an individual to live a longer and healthier life is through early detection and symptom management. Genetic screening can be done to determine the carrier status of parents and predict the likelihood of having a child with cystic fibrosis, and to some extent predict the severity. This is not used to diagnose a patient with cystic fibrosis. Newborn screenings are performed on every newborn in the U.S. It is done by checking for elevated levels of immunoreactive trypsin in dried blood spot samples during the first week of life. However, this may give false positives. The gold standard to test for cystic fibrosis is to test for elevated levels of chloride in an individual suspected of having cystic fibrosis following clinical manifestations such as salty taste to the skin, chronic respiratory problems including persistent cough and sputum production, and failure to thrive, especially when the child has a healthy appetite. Respiratory treatments provide mucus clearance, including high-frequency chest wall oscillation vests that are used to percuss the chest wall and loosen mucus buildup. Handheld PEEP devices, aerosol therapies, including antibiotics, bronchodilators, and nebulizers to help liquefy mucus and reduce inflammation. Prophylactic antibiotic use to prevent respiratory infections. Lung transplants may be performed to prolong life. Nutritional therapies include pancreatic enzymes that are taken with meals in order to allow nutrients to be absorbed and prevent malnutrition. Future treatment includes improved inhaled antibiotic therapies, a vaccine against Pseudomonas, adding a growth hormone to the treatment regimen, gene therapy targeting mutation-specific diagnosis and treatment. Trifecta is a new drug that is just approved by the FDA on October 21, 2019, that binds to the faulty CFTR protein and helps to fold correctly and allows the chloride channels to open so that more chloride is transported across the cell membrane.